Welcome to another edition of the Roundtable. My name is Paul Dingham, and we are glad you are here. We've had a little more time on the Roundtable program to have people sit down and tell us about themselves, tell us about who they are and where they're from and what they're trying to accomplish in the Blue Water area. That is no different today. We are honored to have the Chief Executive Officer of Lake Huron Medical Center, Jay. Pronounce your last name?
De los Reyes.
Nice to meet you.
Nice to meet you. Thanks for having me, Paul. Yeah, absolutely.
To the show, and
Sure.
a friend by the name of Laura Cottengim. Nice to see you.
Nice to see
Marketing
you.
Director of Lake Huron Medical.
Yeah.
Lots of things are going on in the medical industry. From all the conversations we've had over the last 2 or 3 years about Obamacare, whether it's good, bad, or indifferent.
Right.
Insurance companies buying up pharmaceuticals. It's got to be just an exciting time to be in the medical field.
Yeah, I mean, I guess if exciting is one word you could use, and if you're into that kind of thing, it's if you like stability, that's not it's definitely not the industry. I kind of wake up at night sometimes wondering why, is this really what I chose? But it's been interesting. I mean, a lot of change for sure. I think it makes it tough from a long-term planning standpoint.
Yeah, it's got to make it difficult.
For sure.
Lake Huron Medical Center has been with us in the Blue Water area for a couple of years, 3 or 4 years.
Sure.
It's new, but the corporation is not new. Can you tell me about the Prime Health?
Yeah, I can a little bit. I think people still probably refer to mostly in the county as the old Mercy Hospital. Right. That brand is strong up here, which is fine. I think we went through a rebrand just almost 3 years ago at this point to Lake Huron Medical Center, and that's owned by Prime Healthcare,
right,
which is headquartered in Ontario, California, just outside of Los Angeles, and it's still solely owned by one cardiologist, Dr. Prem Reddy, which is pretty incredible for that size organization to still be basically like a family-owned business, because it's a multi-billion-dollar company. So he had his first hospital out in California back in 2001, and really went in to save that hospital. It was where he grew up, and was able to turn it around, continue to be able to deliver high-quality health care to that community because it needed it, and just really replicated that model over and over to here we are 17 years later. There's 20-plus hospitals that they had started owned in the state of California, and then really in the past 3 years came outside of the state, and the company's now 46 hospitals across the country, still owned by one guy. So they've been doing it right for a long time, and really with a mission of going into most of the situations they've been to, they actually are saving a hospital from either closing or going into bankruptcy. That wasn't quite the situation here, but still, Mercy Hospital at the time, or St. Joseph's Mercy at the time, as Trinity was looking to sell the hospital, was certainly in need of support, whether that's from a capital standpoint, to ensure its success over the long term and its viability over the long term.
How long have you been with Prime?
So 9 months.
Okay.
So I started literally, I've never worked for the company before. I've been all over the country, but was actually divesting a hospital from Community Health Systems out of Nashville, was selling that hospital coincidentally to Prime in New Jersey. And last March, they just let me know that the CEO was retiring and asked if I was interested in taking a look. And the rest is kind of history. I got up here in June, and so it's been 9 months with Prime.
Have you had the opportunity to see snow before?
I have. I've actually been in the Midwest, even though I'm from the Deep South, born and raised in Alabama. I've been in the Midwest probably close to 5 years.
Okay.
So I went from Youngstown, Ohio to Fort Wayne, Indiana, and then made my way up here.
Okay, very good. Laura, you are the marketing director. You were with Mercy, and you're still here. You're responsible for numbers of things that are happening at the hospital.
Yep, marketing, business development, and our foundation, which again, with a lot of the changes that Jay discussed and our changes through the acquisition process, that too, you have to pivot hard a lot of different ways on a day-to-day basis, but we are doing very well. We credit that to our clinical teams. What they do is really our service that we offer and can sell the community on.
Let's talk about the hospital specifically. Most people, or a lot of people, not most people, numbers of people, meet you for the first time when they go to the emergency room. Talk to me about the emergency room.
Yeah, I think it's certainly a front door for every hospital, an important front door. That's absolutely where most people are making their first contact. with your organization. I think, and I love that about our organization. We've hospital's been in the community 63 years.
Yeah.
I think the emergency room and the teams that have been serving that for decades have done a wonderful job, and so that continues to be a strength, a core strength for us. I think at the end of the day, despite the ownership changes and those kinds of things, the reputation of the old Mercy and what is Lake Huron Medical Center now is high quality, compassionate care. I think that's still what you're going to get. Those are our roots. We're never going to let go of those. But that's what you're going to get when you walk in the door. It's dependable, high quality care. You're not going to be waiting, like in the metro area for 2 hours to see somebody. We consistently have
some real horror
right,
stories.
and so our door-to-doctor times, which is really what you're looking for when you present in an emergent fashion, to be less than 30 minutes is really a great thing consistently, and we're usually around the 20-minute mark.
That's very good.
So it's great, and then the staff's very passionate and just really focused on the service experience on top of the quality that you're getting. So.
It's such a needed thing.
Sure.
You need that critical care, and you need it immediately.
Absolutely.
And the concerns about driving hours is certainly very, very important.
Agreed.
You also have a cancer center.
We do. That's been probably, if you know your history in the county, that service line or that particular area of healthcare has been a strong niche for the hospital for a number of decades. I think that certainly the offerings are wider spread now. I think in St. Clair County with when McLaren purchased Port Huron and opened the cancer center as well. I think that's a good thing for the community.
Yep.
There's a wider breadth of services. But the technology is the same on both sides of the streets. I think we have a proud history of 40 years and 12,000 plus patients served and cared for through our cancer center. And definitely got the most updated technology from a radiation oncology standpoint with the linear accelerator with true beam technology, which creates just more precise radiation treatments for the patients in the county. So it's still a great strength for us, and it'll continue to be a core focus for us in the future.
The change of equipment is just something that you got to keep up with 24/7. But every time you change equipment, it seems to make it better for the patient, doesn't it?
It does, I think, and that's really the struggle at the end of the day when you talked about the shifting healthcare environment.
Right.
Whether that's the decline in reimbursements or the change in the insurance industry, where hospitals struggle, especially in the community setting, is to really find consistent capital to be able to make those upgrades and keep up with the technology in the metro markets. And all three hospitals, I think, in the county have done a stellar job of trying to make sure you don't have to drive an hour away to get the latest and greatest. And so I think the linear accelerator in the cancer center is a great example of that, but the Vinci Robot, so you hear that a lot in a lot of different settings, robotic surgery. And so we were really excited this past year, and that's really what the hospital wasn't getting for a number of years before Prime bought the hospital, is because there was just a lack of capital investment for a number of years. And so in the last 2.5 years, we've probably gotten more capital in the 2.5 years than we got in the 4 or 5 years combined prior to the transition. And so the Da Vinci Robot's there. It just widens the offering of minimally invasive surgery to all of St. Clair County. And so you want multiple hospitals in the area to be able to provide that type of service. And we're
you see the Da Vinci name in newspapers and radio and TV all over the place.
Sure.
So it does, across the board in surgeries? I mean, does it do only heart? Does it only do cancer patients? Or does it do
There's definitely
everything?
different applications, and I think in terms of how you use the robot, it's really specific to each hospital, really based on the type of specialist you have and what their capabilities are. So that's probably a good segue, because it does you no good to go buy a robot if nobody's robotically trained to be able to use it. And so we're fortunate in this market, and certainly at Lake Huron Medical Center, we were able to recruit, which is going to be a huge challenge when you talk about challenges in healthcare. Recruiting physicians to the county is going to be a huge thing, and I think we're really excited about 2017 and what we were able to accomplish. As you see higher demand for surgeons and specialists, the fact we were able to bring 2 young general surgeons that are robotically trained, one of whom was born in the county and born in Port Huron, born and raised, to come home was great, Aaron Overly. And then Shilpa Mehta is the other one that we brought in at the same time, and he's from the Detroit area. But 2 young guys, robotically trained, highly skilled, that are really focused on building the robotics program at Lake Huron Medical Center. So.
And to have the young guys experienced with the current staff
Sure.
who have the expertise and the
Absolutely.
long, that's a nice blend of people.
Yep.
Yeah, we've been very fortunate because you know, they actually came in at a time where I'm sure you know everybody knows Dr. Wally Damaski's name, and then certainly Chris Valgi. They've both been great mentors. Don Morey, again, been in the community a long time, and so it is great to have that balance where there's maybe not a lot of years left. You know, Damaski retired in September. Dr. Valgi, you'd have to ask him when he's going to hang it up, but it's not going to be another 5 years.
Right.
And so to be able to have that mentoring relationship is certainly a benefit to everybody.
You've had a strong cadre of employees that run the hospital on a day-to-day basis, from the housekeeping personnel through the nurses up to your office.
Sure.
Talk to me about those people.
Yeah, I think that's really, for all the transition and all the changes over the last few years, that's what's the same. Is you still got the same passionate people who largely from this county who are so dedicated to delivering, continue to deliver high quality, compassionate care to this community. And I think that the thing I've been most impressed with in my 9 months is really the longevity. So there's a good mix because you're definitely, you know, natural attrition and people moving to different places. But so we recruit new people, but there's so many folks, and you know, I got to see that in my first annual Employee Service Awards dinner this past week. The amount of people that we honored that were 15 years and 20 years, 25, 30 and 35 years was pretty amazing. And so that's the lifeblood of our organization. It always has been. And I think you need that good balance of the people who have been there.
That's the foundation.
Absolutely, and continue to impress the best parts of our culture onto the new staff. So.
Okay. Now, this lady over here, you are so responsible for a little group organization called Lake Huron Foundation. What is that? What is it?
Well, you know, going back to our acquisition process, one of the true benefits for us is that Prime Healthcare is a for-profit organization.
Okay.
Making that transition, though, there was a serious recognition that there was still need within the community for certain components of our hospital that would be considered nonprofit.
Okay.
So we worked with the acquisitions team hand in hand at a corporate level to say, okay, what are those components? And what that came to be was what is the Lake Huron Foundation, and it includes charity care accounts for patient care needs, whether it be breast cancer or general oncology, patient emergencies. Our volunteer organization that has nearly 100 active volunteers and collectively gave about 10,000 hours of time last year as a complement to patient care providers, and then the People's Clinic for Better Health. And that clinic, as you talk about healthcare changes, is critically important to the community right now. We went through a big shift moving that clinic into community mental health and partnering with them to continue to meet the needs of the underserved population with no insurance, but also to work with them to meet the needs of patients who have co-occurring behavioral and physical health care needs. And
In many cases, they go hand in hand, those two
Yes, they
issues.
do, and that's where that recognition came from, evaluating that we were serving like populations and how could we do better to work with community partners to be better stewards of our dollars to meet those needs and see outcomes for patients that were lasting. And then the last part of that, when Medicaid expansion went into effect, there were not enough primary care physicians in the community to treat the 9,000 patients that had formerly no form of insurance, but now had some form of Medicaid coverage. Now, that was recently repealed with the GOP's tax bill, and though it's supposed to be in effect through this year, we've already seen a huge increase in patients and the need for uninsured care.
So you're saying that there was 9,000 people in St. Clair County that were designated or noted as people who fell into that category?
They obtained some form of Medicaid when Medicaid expansion passed in the state of Michigan, but now
that's been taken away.
They can still do it, but the individual mandate associated with that has been dropped. So they're not going to be penalized financially for not picking it up. So, and in some cases, that's really for the best. But you know, from a clinic perspective, it's critically important to the community. We projected 2017 our numbers would double, and they did, to 2,200 patient visits. and we project that it will double again in 2018. And I think it's very important, and Jay can talk a little bit more about how that plays hand in hand with the contributions that our hospital is able to make.
Yeah, I think it's just a critical component of our organization and for this community. I think it's 25 plus years in existence. The People's Clinic, the foundation as a whole is important, but I think the People's Clinic is just something that's really special for the whole county.
Pretty unique, isn't it?
Absolutely. It's the only one in the county.
Yep.
So I mean, you've got you're always going to. It doesn't matter where you are in the country. There's always going to be a large contingent or a percentage who don't have the means.
Right.
Can't access it because they can't pay for it and they're uninsured. And who's going to provide that care? Because
Right.
they're people just like us. And so I think it's incredible what they've been doing for 2+ decades. But the numbers continue to increase. So you see the need out there, and we're wholly committed to continue to do a great job from that side.
That's marvelous.
And I think too, just from a community perspective, you've seen organizations come together across sectors, across tax status, to look at the economy as a whole, right? And to say, what can we do to work together to make economic improvements? And our hospital is doing that on one side. We're able to do that in one way, meeting a charitable need through our foundation. But again, Jay could talk a little bit about that balance that we're able to make an impact on the community through our hospital.
Yeah, for sure. Yeah, I think just for a moment, I think one of the things I've been trying to share since I've been here publicly is because there's been a lot of questions. I'm just going to be, put that on the table and be honest. I think as Trinity moved out of the market and sold the hospital, there were a lot of questions about who is Prime.
Right,
they're
absolutely.
not right. They're not Michigan based. Here's this company in California. How committed are they really to seeing this hospital succeed and survive for another 63 years? And so those questions were rampant still when I walked in the door last June. Really, still even inside the walls of my own hospital, where employees said, "Hey, are we going to be here? Are we going to close?" And
Right.
I knew if it was inside the walls, it's certainly outside the walls of the hospital. And so I've emphatically been trying to answer that question. The answer is no. We're going to be here. And I think it's even more important that I say that now with the shifting dynamics in the county. I think that everybody goes through Rightsizing. It's just a credit to you. I watch your show. So I think with River District going through their Rightsizing, and they got to do what's best for that organization.
Well, I love that the term is used at General Motors and Ford.
Yeah.
It's right side. Everybody's right-sizing.
And so I think it's even more important as all these organizations are going through that the community understand we're not going anywhere. We've been here 63 years. We're healthy financially, and we're going to continue to be here. And why is it important that we're here? Again, you asked about our employees. It's an organization that, in a small, community, small county, it's 704 jobs.
Wow.
Right, at the end of the day. So our organization still employs 704 people, pays out $39+ million in salaries and wages.
Wonderful.
It can't go anywhere. So
Right.
it's too important. But I think one of the misnomers is that, as a Catholic hospital and a not-for-profit hospital, and a lot of times when I go to markets, people will say, well, it's for-profit. Isn't that a bad thing? And there's really not much difference anymore when you think about for-profit versus not-for-profit healthcare. It's just your tax status. Because not-for-profit organizations are trying to make money as well. They have to. I think the nuns used to say, no margin, no mission, right? So you got to make money.
I can hear them saying
exactly.
that
Yeah.
going down the hall.
So I think one of the misnomers is, hey, well, what's it mean? I think one of the biggest meanings is that usually overnight when you change status like that, you become one of the largest tax bases in the community overnight. And so, so you get a level of support from our tax impact, which last year was over $1.1 million. That goes to support the roads. This size county, it is impactful. I think support the roads, support the schools, support the fire department, police department. And so it's big. I think our presence here means almost $5 million in local vendor purchases, right? But I think the thing I'm most proud of is that sometimes people think that for-profit healthcare means we don't do charity care. So we just talked about our foundation and the People's Clinic, but just in pure charity care alone last year was over $9.2 million, right? So the laws apply to everybody. If they show up at your door, you got to take care of them.
Yeah.
We're wholly committed to doing that.
And the Hippocratic Oath does, too.
Absolutely. And so that's how I think we still have a huge impact, not just in the city of Port Huron, but in St. Clair County, in total. And so we're not going anywhere. I think it's too important when I share those types of facts and those types of numbers. It illustrates the need that we stay in the community for multiple reasons. One, to continue to create access to high quality, compassionate care for the whole county. It gets a little scary when you see access to services maybe start to contract a little bit.
Yeah.
And we're trying to expand those services still. And I think that's the goal of every hospital in the county.
Great. Now, your community support. I didn't, talk to me about that.
Yeah, I think it's important that we continue to support different community organizations. So we as a team this year took a different look at some of the needs that were out there, and we have a list there of over 40 organizations or so that we have budgeted to support in some way in 2018, and we'll be very active in those events.
Sure.
and those needs, and being able to continue to contribute in that way.
Well, you touch a lot of people, employment-wise and in community-wise, and it was important for you to come in and give us a little update
Sure.
on what's going on.
Absolutely.
So, do you like the snow?
I actually do. Despite being born and raised in Alabama, I've grown to love it because I fell in love with snowboarding, and being up here puts me closer to being able to do that during the season. So it's been a lot of fun.
Have we missed anything?
I don't think that we have missed anything. Appreciate the opportunity to cover that.
Well, as I said at the top, there's been so many changes in the whole field of medicine and insurance and coverage, and people are so confused, and
Right.
and whether their rates are going up or rates are going down, or can they go to this hospital or not go to that hospital.
Sure.
That in order to give them a little more information, I think is important.
Sure.
So,
Yeah.
Absolutely.
welcome to the community, sir.
Thank you, sir. So nice to meet you. Thanks for having us.
Thank
Thanks for
you,
the
Paul.
opportunity.
Laura, always
Thank
nice
you.
seeing you. That's about it for this edition of the Roundtable. Thanks very much for tuning in. Till next time, I'm Paul Dingeman. See you soon.